Good morning, everyone. It's a real pleasure to be here and join in this wonderful Research Forum Day. And the Alzheimer's Society of BC is so appreciative of our partnership with UBC and the Brain Health Clinic, and we have had that relationship for many years. And it's a wonderful way to bring together people who are on this journey of dementia and have so much to learn and so much question and need for support. And so by working together, it's really, I think, a great relationship that we are making a difference as we go along the dementia journey. The Alzheimer's Society really thinks of a mantra that really is focused on help for today and hope for tomorrow. And that's really recognizing that the people who are on this journey need help, they need support, they need to be able to feel that they are moving along and doing this the best they can and getting the support from all of us around. At the same time, we need to support the research that's being done here at the UBC, at the center, because ultimately that is what is going to shift things. But the interesting thing, even if there was a cause and a cure, and I'm going to sort of quote Howard Feldman on this, is that even if today we found a cause and a cure for Alzheimer's, for dementia, we are still going to be having families who are experiencing this. And so we need to think as a community what we can do to make a difference. You have heard these stats all the time, and I think the purpose of putting this slide up is just to keep reminding us, as you've heard earlier today, that this is a growing problem as we age because of other disease states being better managed, as many other things are changing the environment, as there are more people over 65 than under the age of 13. This is growing, and so we need to pay attention for many, many reasons. And so it's just important to keep putting the numbers out there, not getting hooked on exactly what those numbers are, but recognizing that this is growing. It's the same about the myths, and we've heard already this morning a number of myths, so there's nothing here that is significantly different that I want to spend time on, except to make the point. The Society spends a lot of time during the year providing training for healthcare professionals who work in long-term care residential homes. And what we find constantly, because we know that the majority of people who live in a care home have dementia, that often these myths are also believed by healthcare professionals. So if the people who are providing care on a daily basis also don't understand really what it's like to also have Alzheimer's or dementia, we know we have a long ways to go. The other really important element about myths is that there is a myth that this is really the end of life. And then I guess in some, sort of hard fact, yes, having Alzheimer's, having dementia is a terminal disease. But for people who are living with the disease, they still have a very productive quality life and still can make a difference. And that is what we want to celebrate and help people continue to do. Perhaps the other biggest myth about having dementia is that the majority of people who have dementia are in a care home. But in fact, what we know in BC, that the majority of people with a diagnosis of dementia actually live in the community. And so that makes us stop and think, well, if we want to change how people are experiencing dementia, we need to look at the community. And so we in the Society have begun to promote what is called Dementia-Friendly communities, and Howard touched upon this earlier. This is a movement that has been ongoing for probably 5-10 years. It started in Japan, it's been building in the UK, and we have been promoting this actually in BC for the past 3 years. And through a number of partners who have come together, we've said, what can we do in the community to promote what is it like to be dementia-friendly? And a community can be defined in many, many ways. We tend to define a community as a municipality. As Lynn shared, we've been working with city councils throughout the province, such as New Westminster, Vancouver, places on the island, to change the policies, the way they do things in their cities to support people with dementia. But a community is also a workplace, a community is a library, a community is everybody in this room today. And so we have to stop and think, what can we do so that people who are on the dementia journey are continuing to have that quality of life? We all want to be remembered for making a difference. We are all people who have legacies, who have stories, who have made differences at different levels. And that is what we want to continue to celebrate and honor and figure out in a community how we can continue to focus on that. This is a wonderful quote by an individual who's very close to our society and who has made a huge difference in our province, in our country, and even internationally, Jim Nan. He lives with dementia, he's a young individual, and he continues to promote what should be done to make a difference. We have a wonderful story a family shared with me recently where she received a call from the pharmacy. And the story began that her mother had gone to the doctor and had received a prescription. Unfortunately, though, in her confusion of what to do next, she took the prescription to the bank. So the bank teller saw the prescription, and rather saying to her, "Mrs. Jones, this is a prescription. You need to go to the drugstore," she said, "Hold on." She went, she phoned the doctor, she inquired what happened, she asked the doctor said yes, she needs to take her prescription to the pharmacy. She then noticed there was a pharmacy across the street, phoned that pharmacy, asked them to come out and meet her at the corner. She then took Mrs. Jones, walked her to the corner, and handed her over to the staff of the pharmacy. That is a dementia-friendly community. That is people thinking about how to help Mrs. Jones. And Mrs. Jones can continue on and be independent and get the prescriptions that she needs. Why do we want to become dementia-friendly? I also stop you again to think about curb cuts. It's a wonderful example. Curb cuts came into being, 20, maybe 25 years ago to assist people with mobility issues. Today, stand outside on a street and watch curb cuts. Everybody uses curb cuts, strollers, able-bodied people, even little dogs. It's what we all use, and that is what we want to do in a dementia-friendly community. It's put changes in that benefits all of us. So in fact, it's just the normal way. And again, people who are living with a very challenging disease still are a part of the community, are making a difference, and feel like a part of it, as well as their family members who are always worried about safety and risk, and maybe now can relax a little bit because they know there's other people watching out. Dementia Friends is a national initiative that the Alzheimer's Societies across Canada and the Public Health Agency of Canada have decided to step up and do something. So we have a very big stretch goal, and it's to sign up 1 million Canadians by July 1st, 2017, a noteworthy birthday for this country, to say that to be a part of the community and to make a difference, you are an individual, and an individual can become a dementia friend and actually begin to think about what they can do. A dementia friend is a person who recognizes it's better to do something than not do something at all. So if you see that person standing at the bus stop and it's pouring rain and they're wearing a sweater, maybe you might stop and ask them if they need help. It's recognizing that we all, coming collectively, can make a difference, but individually we are also promoting change. In the Dementia Friends national campaign, there are really 5 simple things we want people to remember, and that's what's up on the board here. It's not a massive education. It's not a being sophisticated about understanding how it works genetically or anything like that. It's just recognizing that dementia is something that we can all help to make a difference, and that if you have dementia, you are still a person and you still have a great life, and you can actually continue to commit to that community. And with supports, it can be a great experience for everybody. I started the presentation today talking about our wonderful partnership with UBC. And First Link is an early intervention service that the Alzheimer's Society of BC provides throughout the province of BC. And this is another way that we are promoting dementia-friendly communities. It is a way that families who have recently received the diagnosis of Alzheimer's can reach out and connect and start to get the support and education they need. Physicians, healthcare professionals, or even families themselves can refer to the Alzheimer's Society through the either our dementia helpline or through our website or one of our many offices across the province, and begin to get the information so that they can make choices and decisions about what this is going to do in their lives and how they can choose to do what they need to do. It's an important part, again, for connecting and staying in the community. My call to action today for all of you is that while we sit here over the morning, we're going to hear a number of amazing points of information. And the fact that you've all come today has already signaled that you are some way connected to dementia, you're curious about dementia, you want to learn. And that is absolutely wonderful. But the challenge I'm going to give you is when you leave today and you think about all this information you've learned or maybe reaffirmed, the challenge I would like to give you is to share that. But don't share that with someone who already knows. Don't share that with somebody who is already curious, or do. But also, go and find someone who thinks, I don't need to know about that. That's something that happens when you age, when you get older. It hasn't touched my life. That's the challenge. Reach out to somebody who isn't in the curiosity mode or in the mode where they've been touched, and actually begin to bring that person into the community so that we can begin to really support people who are living with dementia and make it a better experience. The Alzheimer's Society really is, again, so appreciative of so many people in volunteers and partnerships, and we are just so happy for the difference that people are already making. And we really encourage you to continue to share the word, and please come to us at any time for support, for information, for education. We want to make a difference. We are going to make a difference. It takes time, and you know what? That's okay, because through a partnership of communities, we're going to move forward. So thank you very much for your time today.